Greetings, residents, families, team members, and friends of St. Paul's. I hope you are all doing well and staying healthy and safe during these unprecedented times. I wanted to reach out to you today regarding a couple important topics that we're currently working on here at St. Paul's. But first, I want to thank you all so very much for your continued patience, understanding, kindness, and commitment to each other and those we serve. As we look at our community as a whole, things are slowly beginning to head back towards a sense of normalcy. More and more businesses are being permitted to reopen their doors. Small group gatherings are beginning to take place, and people are finding ways to get out and enjoy more activities. Mercer County continues to be in Governor Wolf's yellow phase, while surrounding counties have entered into the green phase. This is all positive news as we are all looking forward to returning to life as we once knew it. Many are asking and wondering when St. Paul's will reopen. I can tell you that we have frequent discussions regarding our plan and what it might look like, and most importantly, when we will implement it. We are no different from anyone else. We want to see life within our campus again as it once was. However, we are faced with a tremendous responsibility in which we take extremely seriously. The safety and well-being of our residents and our team has always been and will always be our biggest priority. This responsibility must be the backbone of our reopening plan. In addition to reopening guidance being drafted by CMS along with the PA Department of Health, one of the first steps for us will be assessing reopening risks to our residents and our team. One of the tools we will use to evaluate this risk will be the confirmed case data provided by the PA Department of Health on a daily basis. We will analyze this data for trends associated with Governor Wolf's reopening plan. In order for this data to be useful, we must rely on the passage of time to help us determine whether the risk of community spread has been curtailed. As time passes in each of the governor's reopening phases, the confirmed case data will tell a story as to whether transmission has increased, decreased, or flattened in our communities. Once we have established a comfort level with community transmission levels, we will begin refining our plan to reopen our doors in a safe manner. I am sure by now many of you have seen something on the news or have heard talk about widespread COVID-19 testing in the long-term care setting. Governor Wolf has stated that all residents and staff who live or work in long-term care should be tested for COVID-19. There have also been a series of recommendations issued by CMS, CDC, and PA Department of Health on this topic, some of which are available on our website for your reference. I wanted to take a moment to address this item, which is constantly evolving and changing with the passage of every day. First, St. Paul's has not had any known COVID-19 cases within our community among residents or team members to date. Thus far, we have followed a testing approach in where residents experiencing unexplained symptoms consistent with COVID-19 would be subjected to testing. In addition, we have recommended team members who have failed our screening process to seek guidance from their medical practitioner regarding the same. There are many challenges associated with a widespread testing strategy that we need to better understand and work through before implementing. Some of these challenges include the reliability of test results when administering a test on an individual who is asymptomatic, availability of test kits, availability of personal protective equipment for the person administering the test and receiving the test, the timeliness in which the test can be completed and how long it will take to receive the results, and the overall availability of resources to administer testing on such a large scale. These are just to name a few. Developing a testing strategy is not something we are taking lightly. We must consider all facts and circumstances impacting our organization, residents, and team members as we develop our plan. We are working closely with over 15 other organizations in Western Pennsylvania and various attorneys to cipher through the recommendations received from our regulatory agencies. Historically, testing in the medicine practice has always been used to confirm a medical diagnosis. not necessarily identify one. Widespread testing in our communities would more so be geared towards improving existing infection control policies, such as masking, hand hygiene, social distancing, isolation practices, etc., and not necessarily determining diagnosis. I believe this is an important differentiating factor, especially when considering steps that may be taken given testing results. For example, a negative test result may not necessarily mean easing restrictions on other infection control practices, such as isolation measures. In short, we believe it is absolutely imperative that our testing plan is designed in a mannerism that results in it being effective, useful, and appropriate given our individual circumstances, and this will take time to develop given the tremendous number of external factors at play. Please know that our team is working diligently on this project, and we are committed to ensuring that our plan will be developed in a way that first and foremost meets the needs of our community and ensures compliance with required regulations. Again, I want to thank each of you for your patience, understanding, and cooperation. We are all on the same team working towards the same goal, keeping those who live, work, and visit here safe and healthy. Thank you, and I hope you have a wonderful day.